It's Bill Storms again talking about, I guess you could call this a clinical conundrum case, or just a type of patient we'll see occasionally that just doesn't fit the picture. So it's about local allergic rhinitis. So here's a patient with allergic rhinitis symptoms, but negative skin tests and serum IgE testing. So this patient is 35-year-old with sneezing, congestion, rhinorrhea, itchy eyes, seasonal and perennial, negative skin prick test and negative serum IgE to all the appropriate allergens, normal sinus CAT scan, no history of sinus infections, antihistamines and intranasal steroids have helped. But with a negative skin test, if you think he or she has allergic rhinitis, how do you handle it? Well, you look at a differential diagnosis. It could be, number one, non-allergic rhinitis, which mimics allergic rhinitis, although generally that's a pretty constant chronic problem, and it may be aggravated by different temperature or dust, but not specific pollen season. Vasomotor rhinitis, another, similar symptoms, probably less itching, less eye symptoms, again triggered by temperature, odors, things like that. Chronic rhinosinusitis, this patient didn't have that because the sinus CAT scan was normal, and he or she did not have previous sinus infections. Well, could be local allergic rhinitis. Localized nasal IgE to the various pollens and animals and molds is the difference. So let's take a look at that. Localized nasal IgE-mediated response with a negative skin test. The allergen can affect the nasal mucosa with local IgE production, mast cell activation, and symptoms, and it does not necessarily have evidence of allergy in the blood or with skin testing. So let's look at across the top: allergic rhinitis, local allergic rhinitis, and non-allergic rhinitis. Skin testing for allergic rhinitis is positive. For LAR is negative. For NAR is negative. Serum IgE, positive for allergic rhinitis, negative for the other two. Nasal IgE, now that has to be done in a specific research lab. We can't just order that. Positive for allergic rhinitis and positive for local allergic rhinitis, negative for non-allergic. Nasal allergen provocation test, where you squirt allergen into the nose. Positive in our standard allergic rhinitis patients, positive in local allergic rhinitis, negative in the non-allergic rhinitis. Inflammation, systemic and local, meaning systemic meaning the skin specifically, the eyes, local meaning in the nose, whereas local allergic rhinitis only has inflammation in the nose. There's no evidence of any allergic inflammation in any part of the body. And with non-allergic rhinitis, there is no IgE-mediated inflammation. So the pathophysiology of this is a typical local Th2 inflammation, IL-4, IL-5, IL-13, confined to the nasal mucosa, not in the skin, which causes eosinophils in the nose but not systemically. There's nasal mucosa of IgE produced by B cells in the nasal tissue. It's found in nasal lavage, but it's not in the blood. And I mentioned the nasal allergen provocation test will give symptoms in the allergic rhinitis patient, but not the non-allergic. Treatment. First is pharmacotherapy. Intranasal steroids, oral and or intranasal antihistamines, leukotriene receptor antagonists. All these can be tried, used. But if those symptoms are not controlled with those medications, allergy immunotherapy might be considered. If you have a good history with the seasonality, maybe with exposure to animals or mold or something else, then sub-Q or sublingual routes may be studied. And if they have symptoms around animals, environmental control. Thank you very much.